Thank you very, very much. Well, states hit, but the president could be hit harder then. There's a new poll showing a majority of people, at least in key battleground states, are not flipping over this new health care law. Not all, but many. In fact, in the case of the battleground states right now, most. That could change. Those are states that Barack Obama won handily back in 2008. But DMOS co-founder David Callahan says once the Obama campaign explains how voters will benefit from the law, it will help the president, not hurt the president. You know, I don't know if they have time to do that, though, Dave. What do you think?
Well, they have both time and money. The election is still...
They do have the money, you're right.
The election is still many months away. Also, I don't think that the health care law is going to determine this election. It's definitely going to be the economy.
No, I agree with you on that. But is this another wrinkle, let's say, in those states where the gas prices are high, that this is another sort of fly in the ointment?
Oh, potentially, for sure. And that's why the Obama team definitely has their work cut out for them. One of the advantages they have is that most Americans like all the specific parts of that health care law. They like, you know, extending benefits to young people. A lot of young people are benefiting from being on those insurance plans. They like filling the donut hole, which the health care law does. They even like, by a large margin, subsidizing health care for low-income people.
But they don't like the higher premiums that have come. That was actually forecast in this law.
Well, look at Massachusetts. Massachusetts, where this has actually been in effect, a law of this kind, has seen lower premium increases than the rest of the country. Romney Care has been working, and that's the other thing to bear in mind here, Neil. If Romney is the nominee, which seems likely, it's going to be pretty hard for him to go after that individual mandate, which is...
I don't think the health care thing is going to be an issue. I agree with you on that. I think unless something goes kablooey, premiums keep going up as they have been in anticipation of the law taking over, and bit by 2016, it's fully, you know, operational unless the Supreme Court does something. So you're right about that. But on these other matters, do you think it's more a sense of the president just dodging a bullet, and gas prices might be the thing that undoes it, or a surprise on health care undoes it? What do you think it is?
Well, I think that, again, it's really the macro economy and how people feel things are going. You know, that big important question they asked, do you feel things are wrong? Is the country on the right track? The number of Americans saying, yes, we are on the right track, has doubled just since November.
Yeah, but with all of that, the president's in a fairly tight race nationally with these guys.
Oh, no question about it. This is going to be a tight race. The country
if gas prices still go up, or anything goes slightly wrong in these jobless numbers, then all bets are off, right?
Oh, it's impossible to predict this far out. But the Obama administration and the team, they have a lot of money. They're really good at this campaign. And I think on the health care law, they really have Americans behind them once you get past the sort of, you know, general attack on big government. People say they don't like government in general, but they like a lot of the things.
Well, they like it when it helps them. You're right. You're dead on right.
They like it when it helps them.
David, thank you. One of my favorite guests here, David Callahan, the DMOS co-founder. Meanwhile, for the White House, it's all eyes on Arizona, Michigan, and FBN, in case you didn't hear. Wouldn't you know it, the president trying to compete with our out-of-this-world coverage with his own grand plans. Look at this.